Sorry, everyone.
Completely fine. We are gonna launch. Sorry, we're in like our little practice room. Uh-oh.
All right, Jennifer, can you talk?
Yeah, can you hear me?
Perfect.
Perfect.
Yeah, I tried the link that was sent. I'm sorry, the meeting ID and password, and it wasn't the right one. It still says I'm waiting.
Oh,
So,
well, I'm glad you're on now. Okay, sorry. We're in the little like practice room. I think we're just gonna start the session and launch us, which should lead us to join with the other attendees.
okay.
So, Kiana, can you click that? We are joined by our co-host Kiana and Neen, by the way, from the Asian Pacific Islander American Health Forum. Okay. Hi, everyone. Good afternoon or good morning. Welcome and thank you for joining CSAAH's 11th Biennial Asian American Native Hawaiian and Pacific Islander Health Conference. This is our panel session 4, entitled Thinking Forward Emerging Research Efforts. Thank you for joining us this afternoon or this morning. Reminder that this session is being recorded. If you have any questions for our speakers or panelists throughout the session, please feel free to add it to the Q&A box at the bottom of your screen. For the most part, we're going to try and keep questions to be answered either in the chat or at the end of the session where we have a Q&A session. But yeah, I will just jump into it. So welcome again. And for those just joining, my name is Jennifer Wong. I'm a program manager at the NYU Center for the Study of Asian American Health and your host for today's CSAAH conference sessions. And I'm very pleased to introduce this exciting panel and to kick us off by introducing our esteemed moderator for session 4, Dr. Arnab Mukherjea. Dr. Mukherjea is the department chair and associate professor of public health at California State University, East Bay, and he has made many notable contributions to shaping public health across various avenues, including as an extraordinary and distinguished leader and mentor. I'm very pleased to see him here and have him with us moderating this conversation today. Arnab, I'm going to turn it over to you.
Thank you, Jennifer, and welcome to all of us that are joining us from all areas of the country and hopefully the world. I am very humbled and honored to be the moderator for this session. I'm really excited because I believe we have an awesome set of panelists who really are expanding the scope and pushing the boundaries of what emerging research means, particularly given what we've heard about the tremendous lack of resources and focus on AANH and PI populations across our country. So I think it's important that we continue not only to push the envelope in that regard, but also to really grapple with some of the unique emerging challenges that our communities face, both in terms of research and practice, and of course, underlying all of that being advocacy and empowerment. So again, thank you for allowing me to have this space. You all have the power of Google, so you can Google these wonderful presenters and find out how amazing they are. I would just much rather have them use their remarks to enlighten all of you. And then for those of you that know me, I will always have interesting questions to ask because I like being an active participant in addition to moderating. So it is my honor to start with seeing somebody I've known for a long time, from San Diego State to UCLA to Stanford, now Dr. Adrian Bakong. He is currently a postdoctoral research scholar at the Center for Asian Health Research and Education, located at Stanford University, obviously in the West Coast and California. Dr. Bakong, I turn it over to you.
Thank you so much, Dr. Mukherjea. Let me go ahead and share my screen. All right, perfect. Just waiting for some things to disappear. Well, wonderful. Thank you so much again, Dr. Mukherjea, for the wonderful introduction. Again, my name is Dr. Adrian Bakong. I am a current postdoctoral scholar here at Stanford University. And the title of my talk for today is Cardiovascular Outcomes Among Multiracial Asia-Pacific Islander Groups. And I really want us to kind of think about these directions for future research and how do we expand upon this constant narrative when we think about data disaggregation. First, I'd like to acknowledge that this funding is funded through the American Heart Association as well as Stanford University. And again, the funding that I'll share today does not necessarily represent the views of the NIH, the American Heart Association, or Stanford University. So I'd like to begin our discussion today with a quote. So Kip Fulbeck back in 2003 started a project called the HAPR Project, specifically looking at the experiences of people who identify as multiple races, in particular, people who identify as Asian or Pacific Islander alongside another race. So this is just one of the many quotes from Kip Fulbeck's photo journal from a participant in 2003. And so what they're describing themselves is that I'm a person of color, I'm not half white, I'm not half Asian, I am a whole other. And so when we think about this idea of emerging research, when we think about this idea of how do we move the field forward, oftentimes we need to think about the past. And if we think about this history of the data disaggregation among Asian Americans and Pacific Islanders, it's actually only been around since 2000. And so prior to that, usually we'd be considered as a quote unquote other group. And oftentimes considering this other group comes with a lot of methodological challenges. Ratter and Gorman highlight some of these methodological challenges for multiracial individuals. And what I mean by multiracial individuals are people who identify as more than two races. So for example, Asian and white, Asian and black. So how does this really matter? Well, similar to some of the challenges that we've seen with Asian American Pacific Islander groups, oftentimes studying multiracial individuals is difficult because of small sample sizes. If you do have a multiracial group, oftentimes they get thrown into this heterogeneous multiracial group, which we all know is very much a problem with respect to Asian Pacific Islander people. And then oftentimes too, they ask people to just quote unquote select a single best race. But even in that, sometimes our experiences with respect to racial identity is often based on their context. And if we think about this idea of small sample size, which is often a challenge for Asian Pacific Islander people, what we fail to recognize is how much larger the multiracial population has grown in the past 10 years. Currently, there are nearly 34 million people who identify as multiple races, according to the 2020 US Census. This has grown from 9 million people in 2010, essentially a 270% increase. Now, with respect to Asian Pacific Islander people, about 1 in 5 Asian Pacific Islander Asian people identify as multiple races. But for Pacific Islander people, over half of Pacific Islander people identify as multiple races. And if we think about what are the possible combinations of multiracial Asian Pacific Islanders that are out there, a large majority of them, 2.7 million people identify as both Asian and white. We also see about 220,000 people identifying as white and Islander, 240,000 people identifying as Black and Asian. And we see that there is, a large growth of these individuals. But the problem, as we know with respect to Asian Pacific Islander data, is very similar to the plights of individuals of multiracial identities, that they don't really have good data in our nationally representative surveys. If we kind of think about the history of data disaggregation among Asian people, we know that the last time publicly available disaggregated data on Asian people, and that's only Asian, Indian, Chinese, and Filipino, was back in 2018. But if we think about these sample sizes, you can see here that the sample size of multiracial individuals is pretty large, actually, among some of these large databases. So if we have a growing group of individuals, a growing demographic individuals who challenges this idea of what does race mean? What does single race mean? We kind of have to beg the question is how do we better capture the experiences of people who identify as multiple races? And more importantly, if we do capture the experiences of people who identify as multiple races, what does that mean with respect to our discussions of health disparity? How does this change our idea of health disparities, but also interventions for the future? So what I'd like for you to share briefly with you today is some work using electronic health record data, particularly from the CASPR study known as the cardiovascular disease among Asian and Pacific Islanders. So the CASPR study has about 850,000 electronic health records from 2 healthcare systems here in the United States. One here in California in the Bay Area through the Palo Alto Medical Foundation, and the other in Hawaii. Again, we chose California and Hawaii because those are the 2 largest areas or concentrations of Asian Pacific Islander people. In particular, we were looking at cardiovascular disease as well as related cardiovascular disease outcomes, and all of the measures were done via electronic health records. In addition to that, about 13,000 individuals were sent a supplemental health survey, which essentially recorded health outcomes related to health behaviors, the diet, which you don't normally find in the electronic health record. Now, one of the great things about the CASPR study and about EHR data in general is that it allows us to take a look at large samples of racial groups. So what we specifically looked at CASPR is 8 mutually exclusive single race groups, as you can see here, but we also looked at 4 mutually exclusive multiracial groups. So we looked at people who identified as Asian and white. We also looked at people who identify as Pacific Islander and Asian. And I'm using the term Pacific Islander and Asian rather than Asian Pacific Islander because oftentimes we think about Asian Pacific Islander as the socio-political term that groups Asian Pacific Islander together. But a Pacific Islander and Asian person can refer to somebody who identifies as like Samoan, for example, and Filipino. We looked at people who identified as 3 race groups, so Pacific Islander, Asian, and white, as well as people who identify as Pacific Islander and white. And again, the advantage of taking a look at electronic health record data is oftentimes when we try to look at some of the even smaller Asian groups, such as like Japanese, Korean, oftentimes they're not available in public use data. But in the CASPR sample, we have at bare minimum, nearly 10,000 individuals who identify as Korean, for example. We also had a sizable number of people who identified as Native Hawaiian, so just Native Hawaiian only, as well as other Pacific Islander groups. And as I mentioned earlier, oftentimes one of the challenges for looking at multiracial individuals is that the sample size is pretty small. But in the CASPR data set, we were able to look at large sample sizes of people who identified as multiple race groups. Now, what does that mean for respect to health disparities? Well, unfortunately, it's not looking so good right now. When we think about things like coronary heart disease, we can see here at the top that many of the single race Asian groups are actually performing pretty good with respect to non-Hispanic white individuals. We can see here on the left side that the prevalence is lower as compared to non-Hispanic white people. But with respect to some of the multiracial groups, the prevalence of things like CHD is up to 2 times higher as compared to non-Hispanic white people. In particular, people who identify as Pacific Islander and Asian, people who identify as Pacific Islander white, and people who identify as 3 races, Pacific Islander white and Asian. Unfortunately, these trends are also seen with respect to stroke. We can see that, again, a lot of the single race Asian groups have lower prevalence of stroke as compared to non-Hispanic white people. But again, overwhelmingly, a lot of the multiracial Asian groups are actually having higher prevalence of stroke as compared to non-Hispanic white people. Again, similar things seen with just cardiovascular disease in general. Higher prevalence of cardiovascular disease with respect to not only just single race Asian groups, but also non-Hispanic white people too. And what does this mean for obesity as well? Well, if you take a look at obesity, and if we look here, we can see that with respect to some of the multiracial groups, if you look at the blue bars, you can see that the prevalence of obesity is significantly higher as compared to some of the single race Asian groups, as well as non-Hispanic white individuals. And in addition to that, if we look strictly at people in the electronic health record, again, very similar trends compared to our survey data versus EHR data. So what does this mean, though, in terms of factors that affect health? Well, first of all, if we take a look at this, again, the odds of obesity are significantly higher among much of the multiracial Asian groups. Again, nearly 3 times as high. And this still stays consistent even after accounting for demographic factors, even after accounting for socioeconomic status, and ultimately after accounting for health behaviors. All in all, some of these multiracial groups have 1.8 times higher obesity as compared to non-Hispanic white people. So ultimately, what can we really take away from studies like the CASPR study? Well, first of all, I think there's a lot of strength in thinking about electronic health records as a way for us to not only provide disaggregated data on Asian Pacific people, but also to explore new avenues for other racial groups, such as multiracial Asian Pacific Islander. Unfortunately, we see that with this data set, multiracial groups appear to have worse health compared to non-Hispanic white populations, as well as some of the single race Asian groups. And ultimately that these individual level socioeconomic and health behaviors explain some of the differences in cardiovascular disease, but not all. So really what does this invite us to do? Well, we can think about these new ways to address cardiovascular disease among multiracial groups, because as we think about health disparities 50 years from now, hopefully we don't have any. But as we anticipate what research should look, ultimately what we need to take away is how can we think about measuring health disparities 5 years from now, 10 years from now, and 50 years from now. So thank you so much for your time.
Thank you, Dr. Bakong. And again, it's such an interesting study on actually trying to drill down on the impact of multiculturalism. And you with your work, you always pose more questions than answers, which is fascinating. And I'm really impressed with the trajectory that you have. Moving forward, it is my pleasure to introduce Dr. Gabriela Barajas Gonzalez. She is an assistant professor in the Department of Population Health at NYU Langone Health. She is a bilingual developmental psychologist and a community-engaged researcher whose work aims to reduce disparities in mental health, and academic achievement in the Latina community. Dr. Barajas Gonzalez, the floor is yours.
Hi, everyone. Let me see if the share screen works. Thank you all. I'm going to share a bit about our project with Bangladeshi immigrant families and share a bit about what we've learned specifically regarding restrictive immigration sociopolitical contexts and the impact on Bangladeshi immigrant families and community-based stakeholders in the Bangladeshi immigrant community. And this work could not have been possible without my partner, Sharmeen Hoke, as well as the help of Farzana Karamin, Abu Shah, Shakir, Sabrina Cheng, Kingyang Wang, and Steph Gunkin. When the 2016 presidential election happened, I was working in 25 elementary schools in New York City, looking at the development of Latino children. And at that time, teachers started asking for help managing children's anxiety. And so with a few colleagues, we wrote a social policy report conceptualizing immigration threat as a form of psychological violence for children and families. Really thinking about what it means when you feel like your family is under threat of being separated, or if you as a citizen aren't sure of your rights. Thanks to the motivation and mentoring from my mentor, Kingyang Wang, we decided to also look at the Bangladeshi immigrant community because we were hearing similar concerns among clinicians that we work with and partner with regarding concerns about how to talk about immigration in our parenting groups we had. And so given the limited literature on the impact or just associations or discussions about immigration and being undocumented in the Bangladeshi community, we decided to take a look. And thanks to a CSAAH pilot award, we were able to try to characterize immigration-related stressors and health needs by parent legal vulnerability, and to also examine whether immigration-specific stressors help to explain immigrant parent and child well-being above and beyond the socio-demographic stressors related to financial stress and acculturative stress. We also did some qualitative work with Bangladeshi stakeholders, particularly working either in immigrant-serving communities-based organizations or working in the health services provision section or with the government. We were able to talk to 10 to understand in what ways did the Trump administration and ensuing anti-immigrant climate impact the stakeholders working with the immigrant community in New York City. So I'll just share a bit about our findings, first with families. We were able to survey 73 families. These were all Bangladeshi immigrant parents who participated in Bangla. We used the Perceived Immigration Policy Effects Scale called PIPES, which was created by Cecilia Ayon out of her work with Arizona, to understand the impact specifically of immigration policies on families. And so some sample questions would be like, in the past month, how often did you worry about the impact of immigration policies on your family? Or how often did you fear that your family member would be reported to immigration officials? There's also questions about children's vulnerability, questions about discrimination. And so what we did is we measured some indicators of immigration stress with that PIPE scale that I just mentioned. We also looked at parent well-being as conceptualized as sleep problems. We used the South Asian Tension Scale, which was created with focus groups in the Bangladeshi community in New York and has been published by a different lab. We measured depression with the PHQ-2, And we got parent report of child anxiety, depression, and anger using the PROMIS scale. And so we were able to look at report of both stressors and indicators of well-being amongst parents and children by legal vulnerability. So we were able to look at reports from U.S. citizens, from legal residents, and from parents identifying as undocumented. And what we found is, not surprisingly, the undocumented parents, though their number was very small, were reporting the highest mean stressors regarding immigration stress, and also the highest levels of sleep problems, of tension, and depressive symptoms. We also had parents reporting greater anxiety and depressive symptoms and anger amongst parents who were undocumented versus parents who had legal residence or U.S. citizenship status. When we look to see if immigration stressors were associated with parent health report of health, we did find that adding in the measures of the PIPE scale explained a significant amount of variance in parent sleep problems and parent report of tension and PHQ-2. And we also saw that adding in the immigration stressors was also associated with a significant amount of variance explained for children's anxiety, depression, and anger symptoms. So that let us get a better understanding, or at least some of the first indications of understanding that within the Bangladeshi immigrant community in New York City, we do see an association between levels of legal vulnerability and parent report of their own well-being and that of their children. The next thing we were looking at was the impact on stakeholders in the community, knowing that in many immigrant communities, they may not necessarily turn for support to hospitals or clinics as their first stop, but to community-based organizations instead being the trusted sources of support. So we wanted to know the ways in which stakeholders working in community-based organizations were being impacted by the political climate. And so we found 4 general themes that came up, and all of the interviews were conducted one-on-one by Sharmin Hook, who is a Bangladeshi immigrant. And so we did thematic analysis, and the first theme that really struck us was just the many ways that the 2016 election was different from other presidential elections. And many of the differences were attributed to being created by Trump himself. So Trump was perceived differently from presidents before him. So one stakeholder said the panic increases every day. Every single day he tweets something, every single day he does something, every single day the policy's on the table, and thousands of people deported now. Lots of Bangladeshi people in recent times deported back. So definitely I saw panic. So there was a lot of talk about Trump's use of social media to hint at threats to the community, and also lots of discussion among stakeholders about his use of social media to target certain groups. And so Trump's tweets was definitely a stressor that stakeholders indicated having to sort of make sense of, and not having that experience in other administrations. There was also stress given the multiple immigration policies that were being impacted. So while Trump was in office, I believe there were over 400 immigration policies that were impacted. And so we had stakeholders share with us that it was really hard to give people advice, especially with regards to being able to plan for the future, whether they would be able to ensure the well-being of family members who might be wanting to come to this country. So one stakeholder said, there's a lot of uncertainty as well as financial uncertainty, because a lot of folks, whether through their asylum cases, pending asylum cases, or through DACA or TPS, have been able to get work permits that have allowed them to work and support themselves as well as their families. when those things are threatened, that's also impacting them in a very real way of not being able to really feel safe or confident about being able to survive or thrive or being able to provide for their family. We also heard about stress due to the anti-Muslim rhetoric. I don't know if you all remember during this time, there was a Muslim ban that was also proposed. And so we had one stakeholder who shared, my kids obviously are born here, but it was interesting during the election period. That was the first time that my daughter asked me, oh, do we have to leave America because we're Muslim? And I think the fact that anxiety, you know, in some ways, immigration-wise, we're in a privileged position, we're citizens. And so the fact that even in my household where, you know, for all intents and purposes, we're somewhat legally insulated from that, I think it struck me to see that level of anxiety. So people really reflected as to the anxiety they were seeing, not only in the community, but also in their own home and trying to make sense of what was happening. The second theme we saw was around mobilization, and we saw two different sorts of patterns depending on whether or not the people that we spoke with worked in immigrant serving institutions that were specifically focused on like immigrant rights and advocacy, or whether they were not specifically in immigrant facing institutions, but rather they were like health services providers. For those that were not in immigrant serving communities, what we heard is a real sort of focus in trying to learn more about immigration and in trying to incorporate immigration into their narrative about what it means to be Bangladeshi in the US. And the model minority myth was discussed as something that may be obscuring that narrative from being a part of everyone's awareness. I'll let you read the quote here. But I really want to elevate what was said because we heard a lot about the silence around issues of immigration and the need to just start surfacing that more. We heard that there were not enough resources, and I'll just talk a bit about not enough mental health resources. We heard about not enough funding for linguistic capacity, staff capacity, but there was really an emphasis on a need for more mental health supports, especially with mental health supports that help you not only deal with your anxiety and depression and fear and confusion around questioning what it means to be a Bangladeshi immigrant in the US. There was also different concerns put forward by stakeholders for men and women, people noting that that for the most part, when men are deported, the women really have to play multiple roles in trying to now support families financially and navigate social services on top of the trauma of losing their spouse. And we heard also that there's a need for greater support for the immigrant men who are here by themselves, and how there is also a lot of isolation and loneliness that feeds into heavy drug and alcohol abuse that not a lot of people talk about in the South Asian community. Finally, the stakeholders shared that there's a physical and mental health toll on themselves, having to navigate and support the immigrant community while also managing their own stress. And so we heard specifically about how overwhelming it is to try to anticipate what's going to happen next, given how many policy changes were happening. And we also heard about sleep coming up over and over, not being able to sleep, feeling like you aren't well rested. And we also, I'll leave you with this last quote. This person shared, I would really like to locate someone who I can see as a counselor, a therapist, who will really help me just, you know, stay well, like the physiological and emotional health, because I see myself dwindling. I feel like I don't respond to sadness, happiness in ways that I should. So through the narratives of the community stakeholders that we spoke with and with the families, we were able to sort of start mapping out the multiple ways that the restrictive immigration climate of the 2016 election and the anti-immigrant rhetoric was impacting Bangladeshi immigrant communities in New York City. And we started to integrate a bit of discussion around immigration in the work that we do with Bangladeshi families to try to support, first of all, their own stress management, and also to try to scaffold feelings of safety for their children. And so our closing thoughts were that practitioners working with the Bangladeshi immigrant community should be aware of the adverse impact of restrictive immigration challenges and anti-immigrant rhetoric on health and mental health. And they should ideally proactively acknowledge that national anti-immigrant sentiment increases stress in minoritized immigrant communities. We also see a need for more research to inform the creation of culturally congruent mental health programming that addresses stressors experienced by the Bangladeshi immigrant community. We have multiple stressors related just along both religious lines and also immigrant status lines. And then for anyone working with immigrants serving CBOs, I know in the health field at NYU, for example, we lean a lot on our community-based organization partners to help us or to work with us in order to better serve immigrant communities. And one thing that we are starting to really advocate for is lessening the burden of uncertainty on CBOs by trying to at least partner financially with them and provide a secure and stable source of stipend, because CBOs are really piecing together a lot of resources in order to be able to serve the community, and piecing together resources is another source of stress that they have to manage. I'll end there. Thank you so much.
Thank you, Dr. Bahaz Gonzalez. Again, I know we talk a lot about the nuances of intersectionality, and I think you really elucidated three different elements that we don't see very often. Of course, documentation status, religious identity, and of course, the overlay of the model minority myth. And I just applaud you for really, as somebody who studies South Asian health, really highlighting and centering the Bangladeshi community, because oftentimes non-Asian Indian groups are not included in these types of research. So more discussion to come, I'm sure, but thank you for that wonderful presentation. Moving along, it is my privilege to introduce Dr. Jiapin Kao. She's a postdoctoral fellow at the Center for Study of Asian American Health at the NYU Grossman School of Medicine. Her research focuses on advancing mental health equity among Asian Americans, women, immigrants, and other historically marginalized groups. Dr. Kao.
Thank you for a very warm introduction. I'm going to share my screen here. Yeah, I think like today I will be sharing some of more like my research trajectory from like what I have been doing after I get my PhD and starting my postdoctoral role. So a lot of the work I'm going to share is still ongoing. So would appreciate feedback from the audience and all the other wonderful panelists. So we first started in thinking about the question of like, we have been talking about mental health so much in our community, but what is the state of science over there in terms of like what has been done in regarding to mental health among Asian Americans. So we are in the process of conducting an umbrella review. It's a scoping review of reviews. So we only include reviews in this study. So the question is really broad. Like we just want to say what's there in terms of mental health among Asian Americans. And we have included like 44 reviews already. And the preliminary results is really showing us that there's a very complex reason for like how Asian Americans decide to engage or not to engage in mental health services. And we don't really have very limited understanding of that. Another thing is like we all know like there has been very strong data documenting that Asian Americans compared to all other minorities is like the least likely to use any mental health services. But unfortunately, there's very few interventions have been developed to say how we can really engage them into services. So then other study, because I'm really interested in women's health, and the other study our team has been doing is really to look at so it's actually response to the anti-Asian hate, especially the shooting in Atlanta of Asian American women. So we're really trying to understand how the perceived safety have an influence on Asian women's mental health status. We can actually say, like, in terms of trauma, like everyone we have in our sample experienced gender racial microaggregations. That's a really shocking number to see. And for depression and PTSD is actually also very high in our sample. And we asked those people who indicated themselves who have mental health needs but not able to actually meet their needs, what are the reasons behind them? And the top reasons include, like, they don't know where or how they can get mental health services, and they could not afford it, or they have like other things that are also very important for their in their lives. So inspired by results from the umbrella review and our Asian American Women Safety Study, we applied for a pilot project to really looking at understand, like, what are the multi-level factors influencing mental health service utilization. So because we already know, like, could not afford like mental health care, or like have no idea how to get mental health services, has been identified as the top reasons why they have unneeded mental health. So for this pilot project, we are looking at leveraging the electronic health data of NYU Langone Health. So basically, these people already have access to mental health. So we want to say, even among these people who have access to mental health, what are the reasons they decided to use or not to use mental health services? So for all the people included in the study, they need to have comorbid mental health disorder and a chronic condition ranging from like cardiovascular disease, diabetes, and all this. So again, this is still work in progress. So that's like we are hoping to understand like the reasons by disaggregating Asian American ethnic groups to say the differences across groups. And another project we are currently working on or trying to understand is what we have mentioned, like one of the top reasons is they don't really know like how we can get mental health care. So currently I'm working on my K99R project application, still in the proposal stage. And what we are trying to do is really trying to build community capacity to offer mental health screening and referral services to Chinese Americans who are Chinese American immigrant women who are really from the community. So we are trying to do the cultural adaptation and gender optimization of like evidence-based intervention called screening, brief intervention, and referrals, hoping to use culturally adapted and gender optimized motivational interviewing-based interventions to get people to start to think about whether or not mental health services would be an option for them. So that's like really the projects we are currently working on. And because of the project, we are really we are using a community engaged research approach, and we really want to partner with community-based organizations to reach our target population and also get their feedback in what type of study, what type of adaptation we should be making to make our intervention more attractive to our target population. And because of that, I get the opportunity to work with these two amazing Asian American serving community-based organization. One is CAFAN, Chinese American Family Alliance for Mental Health. They're really working with caregivers of Chinese Americans living with severe mental health disorders. And another one is United Chinese Association of Brooklyn. they are serving mostly like Chinese communities in Brooklyn. A lot of them, a majority of their clients have limited English proficiency. So, yeah, that's basically what I want to share about my journey in terms of like how we get to where we are and what we want to do as our next step moving forward. Thank you.
Thank you, Dr. Cowan. You know, many of us, when we start our journey, have these provocative questions, and we see all of those things bubbling to the surface. So I hope we can discuss that further. But with no further ado, I would like to introduce our final speaker, Dr. Sana Lim. She is an assistant professor who is leading the Gender Equity Scientific Track and Mental Health Scientific Track at the Department of Population Health's Section for Health Equity. As a health equity researcher, Dr. Lim conducts applied community-engaged studies among Asian Americans using intersectionality and syndemic frameworks to understand how multiple marginalization impacts mental and sexual health outcomes. Dr. Lim.
Good afternoon, everyone, and good morning to anyone who's joining from elsewhere. Let me go ahead and share screen. I'm going to give somewhat of a unconventional presentation and talk about all the projects that I love. So it'll be kind of, are you seeing the correct screen? No.
We see the notes screen.
Better.
There we go.
Okay. So I'm going to talk about all the community and student-led studies that I've been working on and kind of focus on how they started, because I think that's important. So we conducted a study right at the beginning of the pandemic on consent and sexual assault among Asian American college students. So this was led by Christina Lee, who at the time was a master's practicum student at Columbia University. And she really said, you know, there's nothing out there. We never talk about sex, and no researchers have done this. And so she really developed the research question. She developed it's a qualitative study, an interview guide, and conducted all the interviews. And I got some wonderful help. It's a wonderful opportunity to like bring in folks who are like-minded. And so they were, you know, the interview guides were reviewed by my, you know, expert friends in sexual violence as well as in Asian American health. And I just used my discretionary funds to pay for participant incentives, really not that much, right? Ideally, you would want to compensate folks more, but for kind of an unfunded study, I think we did okay. And then I think the big lift of it all is that, especially as a junior investigator, is kind of, I have to kind of lead the AARP application process. And so what was great is that we interviewed both men and women. And so I'm not going to talk about my results too much. The baton was handed over to my doctoral, at that time, doctoral student, Nicola Forbes. And she did kind of an intersectional analysis of just the women's data around their experiences around sexual socialization and experiences with consent, relationships, and assault. And so you see kind of the intersection, you're getting gendered and racial messages together. And this is happening at all different levels of influence, but also, you know, focusing on responses and strategies in terms of breaking the cycle, both structurally and individually at the internalized level. But this was really cool to see this come to fruition, and we're about to submit the manuscript shortly. Another study started again at the beginning of the pandemic, and this was around sexual violence among LGBT plus South Asian. Well, the analysis was among LGBT plus, but really was all South Asian young adults in the New York City area. And so how it started, there was an uptick in disclosure of sexual assault on social media and naming of the perpetrators in New York City. And those were kind of prominent South Asian figures, both religiously as well as there were some healthcare providers named, and then of course a lot of backlash. And so this is right at the beginning of COVID-19. And so there was an employee at the time with us, as well as some students kind of got together organically and developed their own kind of advisory board. And they were all comprised of South Asian young adult women. They came up with the logo, they designed the logo and the name, which I love, and it's Research and Action Improving South Asian Sexual Education. And this board continues to actively participate in various studies. No participant incentives, and we really use social media influencers. I can't recall the person's name, but they reached out to a South Asian influencer here in New York City, and we were able to get 400 responses within 2 weeks. So clearly this is something that was really, really needed. And even without incentives, we're really grateful that all the participants participated. We published several manuscripts from this online survey. Really big headline is that LGBT plus participants were more likely to have experienced rape multiple times, meaning greater than 3 times throughout their life, and higher odds of depression compared to their heterosexual South Asian counterparts. And again, research like this is just not out there at all. So another proud mama bear moment to see to have this come to fruition. This is really my research baby on Asian sex trafficking survivors. So how did it start? Sanctuary for Families is the largest service provider for gender-based violence on the East Coast in this country. And there's specifically an anti-trafficking unit. And I worked as a case manager there for 2 years, serving trafficking survivors, mostly Korean, Chinese, and Latina survivors. And then I continued to maintain a relationship with the organization. I provided kind of trauma-informed yoga in Spanish to young Latina women. And then the previous anti-trafficking director requested kind of a research collaboration. When I left in 2010, I said, okay, it'd be amazing if I got my PhD and came back and did research with them. And I was able to, so it was really a dream come true. It actually started out as a CSAAH pilot award, which then kind of expanded as part of a NIH administrative supplement. It's a small grant that's kind of tacked onto a larger grant. And then that kind of enabled me to apply and get my R01. So it's really awesome. And Sanctuary really led the charge. They developed the research question, they reviewed all the instruments, something, even though I had worked in that field, for example, a question that they added was, do police officers, when they come and kind of harass you, does that include kind of taking pictures of you naked? And I wasn't aware that that was a thing, but things like that were really nuanced kind of categories of exploitation. And they assisted with recruitment, and then importantly provided real-time psychological support for participants, either as they're taking the surveys or doing the qualitative interviews. And then they served as co-authors on manuscripts. And just a really quick snapshot of one of our first papers focused on the qualitative data, really looking at the kind of multi-level influence on folks' recovery and well-being. And you can see that kind of stigma occurs at multiple levels of influence. And again, not just using a deficit-based view, really there was a lot of data on resilience and coping strategies among women survivors. And now moving on to my last study, the Jiepin briefly spoke about this, but the Asian Women's Mental Health and Safety Study, how it started. So sorry, don't focus on this picture quite yet because it wasn't started by this person, but it was started by a high school student, Miss Sarah Chevron, and she's at a high school in New Jersey. Apparently high school students now have these research intensive programs and even publish as first authors. I didn't publish my first paper until I was a PhD student. So really impressive. But she was really, she identifies as Asian woman and really was interested in this idea of how does intersectional discrimination impact the mental health of Asian women? And I said, you know what? Nobody's written about this. Nobody's done a study about this. Why don't we launch another survey? So we did a national online survey, again, with no participant incentives. And, again, it was really awesome to kind of leverage my existing team and colleagues to help us out with the survey development. And we were able to get 400 responses nationally. And again, social media influencers. So I don't know if Dr. Jenny Wong would appreciate being called a social media influencer, but I consider her one. And again, this was suggested by my doctoral student. Why don't you just like reach out to her Instagram and see if she can post this on her story? And when she did, we got 150 responses within 24 hours. So I'm learning from my students and I just really appreciate that approach. But she's an amazing author of a book called Permission to Come Home and a huge mental health advocate nationally. I just want to present one piece of data from that study. Something that I'm newly focusing on is Asian women and sleep. Again, very little data on this. When we use the regular kind of general population cutoff score for sleep, self-reported sleep, 99% of the sample reported that they have bad sleep. When we use a higher cutoff, meaning a more used for kind of military personnel, then we still see that the sample is reporting 65% bad sleep. So one takeaway is that Asian women are experiencing really bad sleep and something that needs to be addressed. So ending with some key takeaways, I love supporting students. I love supporting community. It's so much better when they lead the charge. And then finding like-minded collaborators who are willing to donate their time. And then you can do a study with minimal resources to gather pilot data for a larger study. And with the right framing and mechanism, NIH will also support your work. I never thought that NIH would fund my study on Asian women sex trafficking survivors. But yeah, thank you all.
Thank you, Dr. Lim. We could spend 4 hours on all of this work, which probably would not make the NYU organizers happy. But nonetheless, I hope everyone in the audience has some points for conversation. Please reach out to all of the presenters here. I know we have limited time, so I'm going to center the trainees if my more esteemed faculty members don't mind. Many of us in the audience, many of us how we got here, really had a burning question that related to us in a personal way, a developmental way, and an observational way. So I would like to center Dr. Kao and Dr. Bakong. How did you come to the conclusion that you had to focus on the stream of research, and what sustained you to keep it going? Because as Dr. Landoan said, we don't get a lot of resources and support to do this work. So Dr. Kao, I'll start with you if you don't mind.
Sure. So that's a really great question. I think like, especially when you just freshly out of your PhD, it seems like the future is so exciting. You have so much directions you can go, but I really highly encourage everyone to do something that really makes you feel like you belong to that research or you really feel passionate about. Maybe you can do well in doing so many different directions, but hopefully you can find the one that really feels like this is my research. And also I can never stress enough about the importance of mentorship. And actually Dr. Sana Ling, she is my mentor since my postdoc, and she has always been encouraging me to say, is this really what you want? Every time after the meeting, I was like, let me think about it. That's like a whole long process of like leading to where I am today. Yeah, actually like, okay, I will use 30 seconds. So I initially accepted a postdoc somewhere else. And after like several weeks, I was like, nothing really feels right in this position. And I reached back to Sana and say, hey, is your postdoc position still open? I just don't feel like my heart belongs to where my previous choice. So that's like how I get back to Sana, and I'm glad I made that decision because everything feels like works very well.
Dr. Lim, I hope you are truly appreciative of the public accolade. Those are wonderful words. Dr. Bakong, any thoughts on the question?
Yeah, I think, one of the things we kind of have to think about is, for me, even though I don't identify as multiracial in general, I think one of the common themes that a lot of Asian and Pacific Islander people experience is, what does it feel like to be invisible? Whether it's with respect to the data, whether it's with respect to qualitative work, how are we trying to highlight the stories of individuals who might not feel represented? And so, as a Filipino person, like I oftentimes find myself not even highlighted in the work. And I think it's like there's always kind of an overwhelming stereotype, even in like Asian health research specifically, of like certain race groups. So I think for me, as I think about like what is the legacy that I'm going to leave, is to help inspire other students to kind of think about these questions. And also, more importantly, as we think about this kind of question about health equity, about health disparities, we have to think about how things are going to change, especially, with Gen Z, Gen Alpha, or I don't know what the next generation is called, but how are we thinking about setting up good work so that we anticipate the problems of future generations? And one of these problems that I think about is, how are we going to count people? How are we, these kind of ways that we think about race, and we think about race being socially constructed, have changed over time. Like in 2030, we're going to have a new racial category in the census. So how are we going to think about those problems in terms of counting? How are we going to think about those problems in terms of work? And even though my work is specifically on Asian Pacific Islander people, I think it's very applicable in terms of other race and ethnic groups. So I want to try to think about like trainees, not only in terms of people who identify as Asian or Pacific Islander, but also trainees who identify as other races. And how are we going to move that forward?
Thanks, Adrian. It's just so great to see sort of your development across your trajectory. Dr. Barras Gonzalez, briefly, did you want to add anything, given that it looks like your work is in Latinx communities, but you saw a unique context in the Bangladeshi community? So brief remarks?
Yes, so I'll say that in sharing more about my experience with mixed status, I grew up in a mixed status household. I had Bangladeshi peers seek me out, sharing their own experiences. And so that's kind of how it came about, was my sharing something that's not really spoken much about, especially in our academic circles, but really then finding people who can relate in some ways, and wanting to elevate needs in communities that are not necessarily front and center, because there is so much fear and vulnerability in some of these topics.
You're on mute, Arnab.
You're muted.
NYU did that, I'm telling you. Dr. Lim, you had put a nice slide at the end about the takeaways, and I really appreciate that. Any sort of brief aha moments, both in either in your sort of development or what you see in the folks that are coming after you?
I mean, aha moments every day. I mean, what I love is learning from folks. I'm junior, and I'm going to sound old saying this, but like I keep learning from younger folks. So keeping that open mind and joy of learning. I mean, I have aha moments every day. So I just want to say I appreciate the younger generation of scholars that are coming.
Thank you so much to an awesome panel. Again, I know we could do this for a few more hours. For those people that are in the audience that are sort of trying to figure out their path, know that each of us on this panel had the exact same questions you did, and really figuring out what is the impact that we want to have. This panel, among with every other panel that you've seen at this conference and across sort of the nation of AA and HPI health advocates, we love mentoring. We want to embrace you. We want to bring you into our big family. So I believe I speak on behalf of everyone on this panel and through the conference. Please reach out, because if you don't reach out, we don't know that you exist, and we don't know what you want to do. And we really embrace that opportunity and that responsibility. Thank you to CSAAH. Thank you to the Health Forum for hosting this conference. And most importantly, thank you to my wonderful colleagues for this panel. I believe it goes back to Nien, right?
Yes, thanks so much, Dr. Arnab. And thank you for moderating this awesome panel. And thanks to all of our panelists for their wonderful research presentations. So this concludes session 4. Please join us for our next session titled Engaging with Leaders, Advancing Data Equity Using Community-Centered Approaches, coming up next at 3:15 p.m. Eastern, which is right now. And if you have not registered, you can see the link that I added in the chat box. Thanks, everyone.